సార్ ఇప్పుడు మీరన్నారు ఏంటంటే పిల్లల్ని ఎక్కువసేపు పడుకోబెడతాము. మామూలుగా మన పెద్దవాళ్ళ ఇంట్లో గ్రాండ్ మదర్స్ కానీ, మదర్స్ ఎవరైనా సరే వాళ్ళకి షేప్ ఇలా షేప్ ఔట్ అవుతుందని ఒక క్లాత్ ఇలా పెట్టేస్తారు టైట్‌గా. మంచిగా ఈవెన్ షేప్ రావడానికి, కరెక్ట్ షేప్ రావడానికి.
Okay.
అలా చేయొచ్చా సార్ ఇంట్లో?
So, no, not so much. It doesn't make that much of an influence. What generally happens is that if there is an abnormal shape to the skull, especially the most common one is when the baby is sleeping to one
Yes,
side and
it's
there is
flat
causes
shape.
some slanting
Yes.
on the back side of the head. This is what we call as positional plagiocephaly, where the baby is sleeping in one side and causing a significant pressure. The skull is so soft right now that it can be molded like an earthen pot. So like when the pot is very very soft, you can give it the shape. Not so much with scarves and hands, but if we really want to reshape the skull, there are designated 3D printed helmets available to mold it in a specific way. The best way to ensure that your baby doesn't get a flatness on the head
Okay.
is by keeping the baby in a traditional swing where there is not much pressure on the skull when the baby is sleeping. When the baby is sleeping on a flat bed or a cradle which is a hard surface, that tends to create an impression because babies are sleeping for approximately 16 to 18 hours a day. So when they sleep in that same position for a very long time, it creates an impression on the skull. The best way to deal with it is to keep them in a cloth swing where the shape, there is not much pressure on the skull, or use a millet seed pillow. Sometimes, most of the time, it's a mustard seed pillow which they use, which conforms to the shape of the skull.
It's like a
Shape of the skull, yeah. So you keep the mustard seed pillow below so that the baby's skull does not get too much of pressure. And moving the baby to one side and the other, making sure the baby is not sleeping on the same side always, will help prevent this kind of flattening from happening. But most of the times it settles on its own. It doesn't require any surgery. It's as the baby grows, the skull expands back again.